Hello students, my name is Manimugdha Medhi, Assistant Professor, Social Work Program, Faculty of Humanities and Social Sciences, Assam Downtown University. Today we have come to a very important topic known as the principles of social casework or working with individuals. Here we are going to discuss all the principles of social casework uh, and it is one of the most important topics related to social casework as principles. Uh, Knowing the principles is very much important. Here is the content. So first, as the introduction part, as we all know and by now have discussed so many times, that social casework is related to psychosocial treatment of the client who is in problem and seeks the help of caseworker or problem-solving agencies. So social casework establishes adjustments between individual capacities and resources, which we have already discussed in the previous videos. It consists of the study of mental, emotional, and social factors. In social casework, an individual, group situation or phenomena is recognized as a unit of study and various units are studied properly. For example, social group work and community organization. So now we come to the exposition part, that is the principles of social casework. So the principles of social casework are applied in establishing close relationships between caseworker and the client. You can establish the close relationship, the bonding, only true if you respect the principles of social casework. So principle of social casework is very much important in doing a counseling or doing a social casework. Relationship is the medium through which changes can be brought in the behavior and personality of the client. The social casework relationship is the dynamic interaction of attitudes and emotions between the caseworker and the client with the purpose of helping the client to achieve a better adjustment between himself and his or her environment. So we have already discussed in the previous videos that the social casework relationship is a very dynamic interaction, right? And it it deals with the individuals and their problems and help the client achieve a better adjustment between themselves and the environment. Thus, the purpose of establishing relationship is to help the client with his or her psychosocial needs and problems. The relationship between caseworker and client may be more strengthened by using certain principles. Let's look at what are the principles. So the principles given by Felix Biestek, which is one of the most proficient in social casework, he gave at least 7 principles of 8. I have added principles of communication as he has added it later. So there are the 8 prime principles of social casework. There are many more which you can refer from the various other authors, but these are the principles which are commonly followed in casework practice. The first one being principle of acceptance, then principle of individualization, then principle of communication, principle of expression of feelings, then principle of non-judgment, controlled emotional involvement, principle of controlled emotional involvement, principle of non-judgmental attitude, principle of client self-determination, and principle of confidentiality. First, let's look at the principle of acceptance. Social caseworker accepts the client as he is and with all or his or her limitations. So basically, the principle of acceptance says that you need to accept the client no matter how he or she is. Okay, he or she believes that acceptance is the crux of all help. It embraces 2 basic ideas, that is negative and a positive. He or she does not condemn or feel hostile towards a client because his or her behavior differs from approved ones. So a client's behavior may not be approved at times, right? Because see, when a client comes to you, that means there has to be some dysfunction in him or her, right? So you cannot expect a very approved behavior. right? So it can be a disapproved behavior in the which is not according to the norms, or which is not a normal behavior. It can be a disapproved one or a abnormal one. So you have to accept the client however he approaches you. Later on, he or she tries to modify his or her behavior step by step as the casework process goes on. Then acceptance implies liking the client irrespective of his negative qualities and conduct. It is an expression of goodwill towards the client, and criticisms, if any, are done out of goodwill. It is conveying deep concern and active understanding to the client who is liked by the worker in spite of his problem. Behavior for which it is hated or punished by the society. No effective relationship is possible without accepting the client. Unless we are really able to accept the client, we cannot work out this problem. So till the time we do not accept the client, we cannot start the casework process. So that is why we make the casework principle of acceptance as the primary principle out of all the principles. When disliked by us, we may behave to keep him or her off from ourselves, and no positive relations will be possible. So acceptance involves observation of common courtesies and respect for his ideas and treating him as equal to self. Okay. For example, you can show that you have accepted a client by leaving the chair, wishing him, and then moving forward to receive or see him off. Respecting appointments, etc., are indicators of acceptance. So the client needs to feel accepted by the caseworker. Then only he will divulge in all the problems or thinking or opinion, everything he will uh, tell you. Otherwise, he won't. Then we come to the second principle, that is the principle of individualization. So what does it say? Individualization, that is, no two persons are alike in all qualities and traits. So everybody of us, or every person's, or every client is unique. Okay. If every client is unique and every client is different. Okay. Their problems may be the same, but the cause of the problem, the perception towards the problem, and ego strength differs in every individual, right? So the problem is, if the problem is depression, the problem is the same. There are two clients with the same problem, that is depression. But what happens is, the person A is depressed because of something else, and the person B is depressed because of something else. So the problem can be the same, but the cause of the problem or the perception towards the problem can be different. Therefore, each individual client should be treated as a separate entity, and complete information is required to establish close relations in order to solve his or her problem from root. Okay. Individualization is the recognition and understanding of each client's unique qualities and the differential use of principles and methods. Okay. In assisting each other towards a better adjustment. Individualization is based upon the right of human beings to be individuals and to be treated not just as human being, but as this human being with his own personal differences. I hope you have understood. So basically, you have to make sure to have the thought that every person is different and every person is unique. So you have to accept both the client, as they are and as different as they are. The next one comes as the principle of communication. As we all know, communication is a two-way process. One-way communication is like a one-way traffic, right? Uh, two-way, it has to be a two-way process. Otherwise, the communication or effective communication won't happen. There must be a proper communication between the caseworker and the client, which helps in proper understanding of each other, right? It is the road to the identification of the client's problem. The function of the social caseworker is primarily to create an environment in which the client will feel comfortable in giving expression to his or her feelings. It depends on a proper communication. So communication is very much important. If one communicates and the other don't, then that is not a function of casework, right? If the caseworker is telling and not listening at all from the client, then effective communication has not taken place, and that is why the effective casework has not taken place. So same with the client. If the client speaks and don't let the caseworkers speak, then also severe problems can happen. So next we come to the principle of purposeful expression of feelings. So purposeful expression of feelings, what do you mean by that? You have to divide it in two parts, that is purposeful, and number two is expression of feelings. So purposeful expression of feelings is the recognition of the client's needs to express his or her feelings freely, okay, especially their negative feelings. The caseworker listens purposefully, neither discouraging nor condemning the expression of those feelings. Sometimes he or she even stimulates and encourages them when the expression is of therapeutic nature. So when when a caseworker listens purposefully, okay, that means he is listening very carefully and make the client comfortable enough to express their feelings at will. It is to recognize the client's feelings and express it freely before the caseworker, especially their negative feelings. The caseworker listens purposefully, okay, and makes it very important for the the case that he listens carefully and therapeutically. The next one is the principle of controlled emotional involvement. So again, divided into two: control and emotional involvement. So what is control? When the caseworker should not be emotionally involved with the client during the casework process, right? When a client communicates his or her feelings or problems with the caseworker should be in a controlled state of mind. Okay, if the client is telling a very sad story of himself, the caseworker, if he is too emotional, he will show up his emotions and cry off. Okay, so that should not be the case. The caseworker has to respond to all the feelings of the client with their knowledge and understanding. The social caseworker tries to understand the client's feelings and emotions, but he or she, himself or herself, does not involve emotionally in his or her problems. Yes, sometimes we are bound to, involve emotionally with the client's problems, right? Or the client's sadness or the client's grief. But we have to keep our stature in a controlled manner so that we do not, if the client notices that the caseworker is also very emotionally, they can manipulate you and they can take the advantage of the situation, right? So that is why you have to be in a very controlled state of mind so that the the client can be treated in a very therapeutic way. Next is the principle of non-judgmental attitude. The non-judgmental attitude is a quality of casework relationship. Okay, judgment is one of the prime problems in today's scenario, right? The people judge no matter what. Uh, a guy and a boy, if they are going in a motorcycle, right? So the onlookers nowadays, they think that they are, either married or girlfriend and boyfriends, right? But that might not be the case. They might be brothers and sisters as well. So basically what we do is judgment. So the principle of non-judgmental attitude plays a pivotal role in casework process. So the caseworker does not blame the client for his or her problem, nor he assigns any responsibility for his or her miseries. He or she only evaluates the attitude, standards, and actions of the client. So principle of non-judgmental attitude presumes that the social worker should begin the professional relationship without any bias. So this bias word is very important, and which is shown in many of the organizations or in workplace or in therapeutic counseling. So it can be, but all the counselors or caseworkers, they know what they know that they have to handle the casework process or the counseling process in a very unbiased manner, or otherwise it might backfire. He should not form opinion about a client, okay, good or bad, worthy or unworthy. If you are forming an opinion about a client, the treatment process will not go according to you. Principle of client self-determination. This is one of the most important principle. Again, it is the practical recognition of the rights and needs of the client to have freedom in making his own choice and decision in the casework process. So it's basically the client's self-determination which tells us about the client's will to work on his problems. Okay, if the client is not willing, not self-determined to work on his problem, no matter how hard you do your casework process, this won't help. Or no matter how hard you do your treatment process, that won't help. So social responsibility, basically emotional adjustment and personality development are possible only when the person exercises his freedom and choice and decision. Caseworkers have to give this right to the client so that he can decide and take best possible action in his self-interest. This is reasonable also because he knows himself better than others, right? So that is why he is only the one who can be self-determined if anything can be done. The caseworker is only an enabler who helps him through his expertise to take the best possible decision and action in the circumstances, right? So you can only show the way, but the way has to be taken by the client himself. The caseworker should understand that these rights are limited and not an absolute one. There are clients who are unable to take proper decisions by themselves. For example, child or immature adults or mentally retarded persons or psychologically challenged persons, they should not be given this right to harm themselves, right? The client's self-determination is a practical recognition of the right and need of clients to freedom in making his or her own choices and decisions. But this right is limited by the client's capacity for positive and constructive decision making. See, if the client is not able to make their own choices because they are psychologically immature or psychologically challenged, then it is a different thing. But otherwise, if the client is capable of taking their own decision, then he has to be self-determined to work on his choices and decisions to make his problem go away. Next one is the principle of confidentiality, which is one of the most important principles in casework process. So basically, confidentiality means what? It is the preservation of secret information concerning the client, which is disclosed in the professional relationship only, right? So when a client comes to you, he should be assured that whatever the client says to you or the caseworker, it should not go outside the room, right? It should not go at all. I mean, yes, there are files will be maintained, but that should be very personal. Okay, only to the caseworker and the client. Otherwise, if others, if it is not confidential, then someone can take advantage of it. So what basically confidentiality is, it is based upon the basic right of the client. It is an ethical obligation of the caseworker and is necessary for effective casework service. Everyone prefers to keep these things to himself and saves it from leaking out unless its divulge is more beneficial to the person. Once the worker imbibes the values of work and dignity of an individual, he will refrain from encroaching upon the client's privacy and maintain the confidence reposed in him. Once the client loses confidence in him, he will not believe the worker, and the while process of communication will break down, right? So the client has to know that whatever they are speaking or whatever they are doing is confidential, because if the client comes to know that it's not confidential and others are knowing about it, then the communication process will break, and then it will be impossible to assist the client in their problems or fulfillment of their needs. So you can read this example that the concept of confidentiality basically is a Western society concept, and it is much more different than it is in India. So in India, our country wife and husband have minimum things to hide from each other, right? As compared to their Western counterparts, especially American society. So in majority of Indian families, wife cannot be interviewed without explicit permission of the husband or in-laws. Yes, it is true. Its roots lie in our culture, beliefs, and values. Or you can say norm and systems like joint family, etc. Our society is more group oriented as compared to the individual oriented Western society. So our society's group orientation emphasizes on one's duty to others around us. It is these factors that limit the use of principles of confidentiality in our practice, right? So basically, there are a few exceptions of principles of confidentiality. That is, as the contemporary social workers understand that there are exceptions to this client's confidentiality rights in extraordinary circumstances. For example, when the clients threaten to harm themselves, if you know that the client is, very much in the position to harm themselves, then at that time you can bring the confidentiality clause and you can inform the family members or or your supervisor. If the if the client threatened to harm the caseworker, then also you can do the same. You can break the confidentiality clause. Or if the caseworker or if the client is in constant abuse or if the client abuses or neglects a child or an older person, then also the confidentiality clause can be broken. As the National Association of Social Workers (NASW) Code of Ethics states that the general expectation that social workers will keep information confidential does not apply when disclosure is necessary to prevent serious, foreseeable, and imminent harm to a client or other identifiable person. So, if there is a if there is a probability of harm which can be done by the client to their immediate family members or to the social worker, okay, or to the organization, then the confidentiality clause can be broken. So in conclusion, all the principles given by various social workers are so important, so important. There are so many other principles other than these 8 principles. BSX principles are one of the most commonly practiced and followed in social work profession, but there are so many other principles which you can refer. But we have to keep in mind that these principles, deals with the clients, and it will help you in dealing with the clients at all times. But you have to keep in mind that these principles while engaging in a social work practice. Okay, so basically we have come to know that principles of social work or social casework is very much important for our casework practice, right? Um, Thank you, and I hope you have understood the concept today. And please go through all the notes and and get your questions ready. Okay, thank you.